If your hips feel stiff, cranky, like they're kind of starting to affect your day to day, whether it's in workouts, walking, or even just getting comfortable, this class is a really good place to start. Today, we're going to focus on a hip mobility class that's going to build strength and range in places that you often don't train. What you're going to need to complete this class is some floor space. If you have a yoga block, grab it. A thick book works great if you don't have a yoga block, and a yoga mat or just something comfortable to keep your knees comfy. This class is a small sample of the kind of work that I include in my 6-week program, the Hip Mobility Lab. So after you feel how good this class is going to make your hips move, make sure to check that out. Together, we're going to open up a range into your hips and then strengthen that range using 5 key exercises. As you go through this class, pay attention to what feels limited or shaky. These are going to be the spots where your hips need a little extra support. Let's start by warming up your hips. Come into a sideline position where we're going to practice hip cars or controlled articular rotations. All that means is we're taking your hip through its fullest, greatest range of motion to warm up every single cell all the way along the edge of the hip capsule before we start putting in some work. So come sideline just like this. We can start by stacking your knees. They're a little bit below hip level. Go ahead and clasp your hands either directly out in front of you like this, or if it's comfortable, you can be overhead like this. This is going to help to lock out your torso and minimize the movement happening in this area, which is going to maximize the movement happening in your hips specifically. And that's what we want from a hip car. So that's the goal. Keep the torso as stable as possible. We're going to start by pulling your knee up towards your shoulder. Then we're going to take you through a big circle, slowly opening up the hip as wide as you can until you get a really good squeeze in the glute right here. Keep that circle going by pulling your knee back behind you. Towards this couch back here is where I'm pulling my knee. Now I feel my glute activating until I come towards the ground and back to the start position. That is half of a rep to warm up your hip. Let's go back the other way. So you're going to pull your knee back behind you until you can squeeze your glute. Come up, opening up nice and wide. Pull your knee back towards your shoulder and down. So you see how we just made a really big circle? What we're doing is we're bringing blood flow deep into our hip structure. We're bringing nutrients deep into that hip structure. And we're warming up all the cells that are deepest into the hip by doing this circular motion. Let's do another couple together. So bring the knee up towards your shoulder. Open up as wide through the hip as you can get. Maximum range of motion while still keeping your hip bones stacked on top of each other. We notice how the torso did not come backwards this way. That means you're using your spine instead of your hip. Continue your circle by pulling your knee as far back behind you as you can, finding your glute, and slowly coming back down to the ground and back to your start position. Let's move back the other way. Pull the knee back behind you, find your glute. Open up wide through the hip. We're getting that nice squeeze in the glute in the side of the hip here. Keep coming back up, bringing your knee towards your shoulder and back to your start position. Let's go again. Knee towards shoulder. Last rep here, opening up as wide as you can. Pull that knee as far back behind you as you can. Squeeze your glute. Come back down. And reverse it. Pull the knee back behind you. Open up as wide as you can. Pull the knee towards your shoulder and down. So as you can see, the goal here is how much can we move your hip without the rest of your body helping or moving for it. Let's go ahead and switch to the opposite side. An important thing to know about joints and why this type of a warm-up has so much value is that it's hard to get blood flow to the deepest tissue inside your joints. Your skin gets great blood flow. Your muscles, great blood flow. The deepest part of your joints gets the most blood flow through movement. So when we take our joint through these full ranges of motion, it's actually very healing for our cell structure within that joint. So here we go again, opposite side. Clasp your hands either overhead or directly in front of you, whatever is most comfortable to keep your torso still. Pull your knee up towards your shoulder. Open up as wide as you can, doing a double check that your hip bones stay stacked on top of each other. We didn't move backwards. Pull the knee back behind you as far as you can, squeezing your glute, coming down towards the ground. Back to our start position and reverse. Pull the knee back behind you. Open up through the hip, finding that nice squeeze right here. Pull the knee back towards your shoulder and down. That's 1 rep out of 3. Pull the knee towards your shoulder. Open up as wide as you can. Find that maximum range of motion without that hip bone moving backwards. Then start to pull the knee back behind your hip. Find your glute muscle. Give that a good squeeze. That's how you know you're really pulling the knee back behind you. I'm pulling it towards the couch. Coming down, start position, and reverse. Find the glute again. Give the glute a good squeeze. Pull up. We got that side of the hip working. Knee towards shoulder and down. Last rep, 3 out of 3 here. Pull the knee towards your shoulder. Open up wide through the hip. Pull the knee as far back behind you as you can get it. If you're getting a little shake in the hip at that point, this is a good thing. And reverse it. Last time here, pull the knee back behind you. Open up through the hip, towards the shoulder, and down. If your hip felt like it was activating stuff in there that you don't get activated very often, if you got a little bit of shake, if you got a little bit of cramping, any of those sort of sensations, it's a really good sign that your hip actually has so much more potential than what you're currently using. It just needs to understand how to engage all the cells, all the muscle structure, all the connective tissue that surrounds your hip. And we're going to teach it how to do that. Next, grab a yoga block, a thick book, or even a couple pillows stacked up will work great. We're going to train hip internal rotation. This is a spot that often gets missed in a lot of mobility work that we all need. It's absolutely vital to a really buttery feeling hip. So go ahead and start in 90-90. How do you know if you're in 90-90? Your back knee, this is the leg that we're focusing on, is going to be lined up with the center of your hip, and that heel is lined up with the center of your knee. We also have a 90-degree bend in the front leg. We're not going to worry too much about the front leg. It is this leg that we're focusing on. Take your yoga block and go ahead and prop yourself up on your yoga block. We want your hip to be higher than your knee. You're going to take your hands and you're going to kickstand your hands back behind you. Some people struggle to reach the floor on this side. If that's you, go ahead and grab a second yoga block or any other object and just prop it underneath this hand. If you're struggling to hold yourself here at all, you can prop yourself up even on 2 hands, 2 yoga blocks, 2 objects. That makes it significantly easier. Okay, next we have to find our stretch. We're going to focus on this part of the hip right here. You're going to think about your chest twisting towards your back foot. As you twist your chest towards your back foot, what's happening is your pelvis is moving around your femur, this bone in your leg right here. And that gives us a stretch sensation right here on the lateral side of the hip. Some people get it a little bit down this line here. That's okay. This is the preference. This is the best spot. If you feel it in your adductor, your inner leg through here, we call that a red flag. All right. If you feel that, I want you to move your knee a little bit forward and see if that helps you get out of the sensation in the inside of your adductor and more of a sensation into the side of your hip. All right. We're just sitting in here for a minute, just being in the stretch. So just go ahead and relax into the stretch and take a few deep breaths, okay? In through the nose and a really long exhale. After a couple deep breaths, you might find that you can get a little bit deeper into the stretch by turning your chest even more towards that back leg, deepening the sensation into the lateral hip. We're getting really deep into the hip capsule here. We're trying to stretch tissue that's quite deep towards the actual capsule or towards the bone of the hip. This is a very good thing. It helps us to open up a little bit of space in the hip capsule itself to keep our hips feeling really healthy, really buttery, really supple. All right, so let's go ahead and take a couple more breaths in through the nose. Long exhale through the mouth. Try to make your exhale twice as long as your inhale. In through the nose. Long exhale through the mouth. If you're somebody that's feeling this on the inside of your knee, you can move your knee forward until the sensation is gone from the inside of the knee to make that a little bit more comfortable. One more deep breath. Now we're going to create a little bit of activation. This is again going to bring blood flow and nutrients to deep into the hip. It's also going to strengthen the hip capsule and give it a lot more stability and tell your body, hey, this tissue is important. Lay down more healthy tissue here. That is the signal we are sending the body with the contraction that we're about to do. How do you create that contraction? Push your foot down into the floor. Imagine that there is a how do we create that contraction? Push your foot down into the floor. Imagine that there is a scale sitting underneath your foot and you want to see the amount on that scale, the number on that scale increasing. So maybe you're starting with 10 pounds of pressure putting down, and then you can build up to 15 pounds of pressure. And imagine that you could see 20 pounds of pressure on that scale and slowly try to increase how hard you're pushing your foot down into the scale that you're imagining on the ground. If you're getting a little bit shaky in the hip, that's a really good sign that we're using tissue that is learning how to do its job. It's trying to understand how to do its job while pushing, and that's great. 3, 2, 1. Relax that pressure. Take a deep breath in. On your exhale, see if you can get a little deeper into the stretch, turning your chest more towards your back foot. Even if you got just millimeters deeper, amazing. That adds up a lot over the weeks and months of doing the exercises to get more range. We're going to do this one more time. You're imagining your scale. Start to push your foot down into the scale. On the second round, let's see if we can ramp up a little bit faster and a little bit harder. So can you push harder on the second round compared to the first time around? Can you build up that number on the scale even more? If you got to a hypothetical 25 pounds of pressure, 20 pounds of pressure the first time, maybe you can get to 25 pounds of pressure or even 30 pounds of pressure. Can you find a bit of a shake in the hip here? Can you find that sensation that we're building strength into your hip? And relax. Take a deep breath in. Deep breath, and go ahead and exhale really slow. Turning your chest more towards your back foot. And we'll slowly move out of that. Move that around, shake that hip out a little bit. Do whatever you need to do, and then we're going to switch to the opposite side. So we got to get our 90-90 on the opposite side. So our knee is lined up with the center of our hip. Our heel is lined up with the center of our knee. We've got about 90 degrees on the front leg. We don't worry about the front leg too much. We're focusing on this guy. Grab your yoga block or thick book, put it underneath your hip. It is okay if your front knee comes off the ground. It will come off the ground. Kickstand your hands back behind you and turn your chest towards your back foot. Go ahead and turn as far as you can, trying to get as much range as you can and finding our stretch right here. A lot of people say that this stretch feels really deep. It feels like you're almost stretching towards the bone. You're not actually stretching bone, but because we're stretching your connective tissue that is deepest inside your hip joint, that is a sensation that tends to be created, especially if you haven't done a lot of hip internal rotation in your training, if this is a little bit new to you. Again, if you get any sensation in your adductor right in here, that is a red flag. It means that this range, you're not going to be able to create more range easily if you feel it here instead of here. Go ahead and move that knee as far forward as you need to until the sensation comes out of the adductor and more into the lateral hip right here. Move it back if you can. And then over time of doing the class on repeat over and over, because this stuff is progressive, it adds up, you'll find you'll slowly be able to move your knee backwards as the hip becomes more open, and the stretch sensation will stay in the spot that you're more so looking for. Okay, we got a few more breaths here before we start our pails, which is our pushing, our activation. So I want you to take a big breath in through the nose and a really long exhale. Trying to make your exhales twice as long as the inhale if possible. This just helps your body relax, which when our nervous system is relaxed, it's way faster to find more range. The exercises are way more effective the more relaxed we can be during the stretching portion. All right, we're ready for our first contraction. Go ahead and start pushing your foot down into the ground. Everything that was just being stretched is now being strengthened. Make sure your knee is staying supported on the ground. It is not coming up as you're pushing your foot into the ground. The knee is staying supported. We're just slowly increasing the pressure that we are using, thinking about that scale. See if we can increase it just a little bit more. And 3, 2, 1, relax the contraction. Take a breath in. And on the exhale, see, can you turn a little bit deeper into the stretch by turning your chest more towards that back leg. Take a deep breath in that deeper range. Millimeters counts. Millimeters adds up a lot over the weeks and months of practicing and repeating, because that's how biology changes, is repetition. So we're going to do it one more time. Go ahead and start driving your foot down into the ground. Just like the other side, our second side, we're going to try to increase the pressure a little bit faster and see if we can end up pushing a little bit harder than you did on the first time around. We're sending our body a signal here. We're saying, hey body, this tissue, it's important. Lay down more healthy tissue deep into my hip. Send blood flow here. Send nutrients here. That food that I'm eating, bring it into this area and use it for repair and strength. That is the signal we are saying to our body as we drive our foot into the ground. So keep pushing for another 3, 2, 1. Relax the contraction. Breathe in. Long exhale, seeing if you can turn slightly deeper into your stretch. And slowly move yourself out of that. So we just created a little bit more range into internal rotation. Now we're going to create a little bit more range into abduction We're using both range and strength. So I'm going to set my yoga block off to the side, and I'm just going to grab something comfortable to have my knees on. Since I'm on a rubber floor here, you can use a yoga mat, a blanket on the floor. If you're just on carpet, that's perfect. That's all you need. But just so that you have something comfortable for your knees would be great. We're going to come into a frog, pails, and rails. So you're going to have your knees lined up with your hips, and you're just going to let them come out as wide as is comfortable until you get a stretch into your inner leg. And you go ahead and place your elbows and your hands on the ground here. And I want you to take a deep breath in and a really long exhale. Deep breath in, really long exhale. We're currently stretching the short adductor. So it's pretty close up towards your pelvis in here. Really important pelvic stabilizer. And we're also going to build a little bit of strength into that area. How we're going to do that is you're going to imagine that you could pinch the floor with your knees. You're going to push them into the floor and towards each other, and you're going to feel activation happening in the exact spot that we're stretching. Let's go ahead and do that now. Go ahead and start pinching the floor with your knees. And you're going to feel activation happening deep into your hips and into the adductor now. The stretch sensation is going to be much softer, less of a stretch, but it's going to feel like you're using that tissue and activating it. You're going to relax that stretch now. And now I want you to think about trying to pull your knees away from each other. Even if it's just a tiny bit, millimeters counts. Can you pull them away from each other? We might even get a contraction into our outer hips while doing that. And you're just going to relax that contraction. Take a deep breath in and out. One more deep breath in. Long exhale. And go for it again. Squeeze your knees together. Imagine that you're pinching the floor. You're activating all the tissue deep in your inner hip bone, or inner hip socket really, and into your adductors on those inner legs. Can you squeeze a little harder for 5, 4, 3, 2, 1. Relax that contraction. And now can you pull your knees farther apart from each other? Millimeters counts, even if you can't. It's just, and you feel activation happening in the outer hip. That's great. That's your muscles learning, and you will get effect over time. Relax that contraction. Deep breath in. Last long exhale. And we're slowly going to come out of that. All right. 3 out of our 5 exercises are now complete. Let's keep moving, because our next goal is to build way more strength into our hips than we've ever had. Because that's how hips really feel buttery and gain a lot of range of motion. It is not just about the stretching and the range of motion. It is about teaching our hips how to do their job. A hip that understands how to do its job feels so good. A hip that has strong connective tissue is so capable and feels capable. You feel confident in your hip when you can feel how strong that connective tissue is. So how do we do that? We're going to come back into our 90-90, just like this. Again, we're going to focus on the trail leg, this leg here. I want you to keep your chest facing forward. You can have your hand and grab onto your front leg just so that it encourages you to not twist and open your body. And then you're going to raise that back knee off the floor and hold it up, getting a squeeze in the side of the hip right here. Little squeeze, hold that up. How high can you get your knee? And slowly bring the knee back down to the ground. Even if your knee barely came off the ground, as long as you feel sensation, it is going to give you value. It is going to help you. This is about training the range that you have already, which eventually is going to give you more range. Same thing again, keep your chest forward as you raise that knee. I don't want this to happen. We're not opening through the torso. We're keeping our torso forward. This is going to help keep all the sensation into the hip. Bring it back down to the ground. 3 more reps. Pull the knee off the ground. Hold, chest forward, down. 2 more reps. Up, hold, fight for more height. Can you get that knee even higher? Down. Last rep. Up, hold. Last rep on the side, fight for the height. Could you possibly get the knee even a little bit higher? Shaking is good. Cramping is your body learning how to use the muscle. Try to lean into that, find that strength, and rest. All right, same thing, opposite side. Knee starts in line with your hip. My hand is just over here resting. If my wrists get sore from these positions, I can place my hand on my yoga block, and it's going to feel way more comfortable. All right, go ahead and lift that knee up. If you feel like your body wants to turn, grab onto the front of your leg. It's going to prevent you from twisting and using your torso to help you out here. Come back down. There is so much benefit for teaching the hip how to work without your torso getting involved. Hold, 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 and down. If these feel easy, as you get stronger, you can always add a weight just like this. This is a little 10-pound plate here. And that's how you progress these over time. Because of course, having structure where it's progressive and you slowly over the time increase the difficulty is just going to make your hips stronger and stronger and stronger, and you're going to feel even better. Last rep, coming up, hold. Can you get your knee higher? Can you find a little bit more height? And come down. All right, hips should start to be feeling like they're getting a strength workout, because good mobility training is strength training for your joints, right? That's why we need it to be progressive, just like when you're lifting in the gym. Same concepts, but for connective tissue. Okay, so we've come to the end of our 4th exercise. We have one more. This is going to get our hips to train really strong rotation and strengthen our tissue, again, really deep into that capsular space. So we're going to come back into our side lying position here. Go ahead and grab your hands here or again overhead like we started with. We're going to do something called axial rotations. So starting similar to where we were at with our hip cars, we're going to have our knee just here, and you're going to be like, how far can I internally rotate? And then how far can I externally rotate? I want you to imagine that your knee is the pivot point, meaning that it's not going to move, right? So you notice that as I'm moving, my knee isn't doing this. Like my knee's not moving around. I'm keeping my knee in the same spot the whole time. If it helps you to put a hand here, just to kind of imagine that that knee is the pivot point and it's not moving, everything else is moving, that's great. Go ahead and put your hand there. And you internally rotate as much as you can, and then externally rotate as much as you can. Every single time you hit your end range, you go, is this really my end range? Could I twist a little bit more? And that's how you're going to get stronger over time. Constantly kind of questioning yourself. So you're not just going through the range of motions, but pausing in your end ranges and questioning, could I go a little bit more? Other way, could I go a little bit more? Let's go last one into external rotation. Could I go a little bit more? All right. Opposite side. You can be here, you can be here, or have one hand here and one hand just making sure your knee's not moving. Okay, so internally rotate. How far can you go? We get this great contraction in the hip here. Externally rotate. How far can you go? You're going to notice that your femur, this bone here, is twisting in the hip capsule. That's how we're strengthening the connective tissue. that's really deep in there. We're asking this connective tissue deep into the hip to learn how to do a lot of work. The cool thing about that is your deepest tissue in your hip, it's the first thing that knows that you're moving. If you're taking a step, if you're doing a squat rep in the gym, or a lunge, or walking upstairs, or even bending down to pick up your kid and pick them up, the first thing that moves is your deepest inner tissue. So if we can get that stronger and healthier, that just spreads outwards to everything else. It makes such a big difference, especially if they're one of those people that's like, I don't know, I just go to the gym and then I hurt myself and then I heal that and then I go back and then something else tweaks and it's just a cycle. It's usually that you want to work the deepest inner stuff in your joints. So if you're that person, pay attention to that. Okay, last couple of reps here. How far can we go into internal? How far can we go into external? And rest. Okay, we just really worked our hips there. All right, take a second and move around. If that felt good or even just different, it's a really good sign that your hips have more potential than they're currently using. The tricky part is knowing what to do next, instead of just repeating random drills without a plan. That's why in my 6-week program, the Hip Mobility Lab, we start with an assessment so that I can tell you exactly what your hips need. So we can assess, not guess, and then you progress even faster. And then guide you through 6 weeks of progressive work so that we can build a lot of strength and range into your hips while working smarter, not harder. It's designed to take the guesswork out of training your hips and give you something that you can always come back to with structure because it has lifetime access. And if you got anything new out of class today, please don't forget to hit the like button and leave me a comment telling me what that was. It really helps in this algorithm world and I really appreciate it.